subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Tom Cherian. Dr. Tom Cherian is going to be speaking with us today on liver care for senior citizens. And he will, of course, be answering all our questions. A little about Dr. Cherian. He is a leading liver specialist and surgeon and is attached to the Wockhardt Hospitals and the South Asian Liver Institute. And he is connected with us today from Hyderabad. Dr. Cherian obtained his specialty FRCS and received his certificate of completion of specialist training in 2008. On finishing his training, he worked for 5 years at King's College Hospital in London before returning to India. He has over 12 years experience in advanced pancreatic and liver surgery with over 300 major procedures, including anatomical, laparoscopic liver resections. He has performed over 650 liver transplants, including paediatric, split, and auxiliary transplants, and has trained several consultant surgeons. He is a recipient of 8 travel grants with over 84 publications and 100 international presentations. He is an ACS accredited ATLS instructor and the British Journal of Surgery Prize paper speaker in 2007 and 2008. He has an advanced international diploma from Switzerland and is a sub-investigator for phase 3 international MCTs. Dr. Cherian is an MD examiner for the University of Pisa in Italy. He is a senior advisor with Telangana State for liver transplantation. And, it is World Liver Day on Tuesday, that is April 19th. And we just thought it was appropriate to have, to request Dr. Cherian, who is, as we know from the South Asian Liver Institute, a leading liver center for liver studies and research, etc., which is based in Hyderabad, and of course the Wockhardt Hospitals in Mumbai. Welcome to Health Live at Seniors Today, Dr. Cherian.
Thank you so much for that warm welcome and praise that is hardly deserved. So I am a part of Wockhardt Group, and we are together, the South Asian and Wockhardt Hospitals are together trying to create a liver institute of note in Mumbai. Liver disease is surprisingly prevalent in our country, and yet good centers that are able to cater to all the needs of a liver patient is not as common as you would think, or as common, definitely not as common as is necessary. And so we are just trying to create something and see whether we can make a difference.
What you're saying is absolutely correct. We've been running the Health Live webinars for the last 100 weeks, over 100 weeks, and this is just a second session that we are doing on liver, and one we did around 8 to 9 months back, and now this is the second session. So that just shows that even people like us who are concerned with health issues and specifically on issues concerning the liver, it's perhaps the importance of the liver is not really taken into consideration. Doctor, before we get into the questions from our readers and the various people who have assembled here, a few opening remarks from you about liver care and liver care specifically for senior citizens.
So I think the most positive thing that I want to say to the senior citizens is, of all the organs, personally, I think the liver is the one that does not age. So, for example, because we do liver transplants, we have taken livers from men and women who are in their 70s and implanted it into young people, maybe as young as 21 and 28, and there has been no difference in their liver function, and the liver almost regenerates itself and recalibrates itself to somebody to somebody's liver or somebody's age many times lower than their own or its own. So I think that's the first thing to say, that the liver, as far as we know, doesn't age much, and definitely doesn't age as far as, let us say, muscles are concerned. So when you are 70, you might not be able to climb a mountain with the same speed or ease as you could when you were 20. Whereas from a liver point of view, it can digest a meal almost as well at 70 compared to when you were 20. So I guess that's the most positive thing about the liver. The second thing is, given that there is still age-related damage that happens to the liver if it is not looked after. But again, I would say that it's one of those organs that hardly need any looking after. In fact, if you sort of stick to sensibilities, like you know what your weight should be, you know when you're overweight, or at least you should know when you're overweight, and take steps to correct that. If you are eating a very unbalanced diet, you know you're eating an unbalanced diet, come back to what I would call a middle path. If you think you are consuming too much alcohol, again, that is not something that is not so easy to know. So that's something that you might need to keep a closer eye on than you might suspect, because it's easy to drink a little bit more than you think you are drinking. And I think these few things is all that is required in order to keep the liver as good as we need it to for many, many years to come.
Right. Thank you, Doctor. I think clearly there, your opening remarks are heartening to note that things, the liver is, as an organ, generally in very good shape. But the very fact that there is an existence of a South Asian Liver Institute, and the number of specialists in this area are increasing, it does mean that there is the problem is increasing in the country of issues concerning the liver.
Yeah, that is the whole point. I hope to make a difference. And the liver is such a beautiful organ. At Wockhardt and South Asian together, what we hope to do is simply harness the natural ability of the liver to regenerate. So actually, we are not trying to do anything to this thing. We are simply trying to make it bring the regenerative capacity of the liver to allow us to repair the liver at a stage where it is still repairable. So another fascinating thing about the liver is the liver is got a regenerative capacity that is second only to skin. Almost no other organ in the body has got such an ability to regenerate. For example, there are times that we actually are able to do experiments with, for example, rats, and we can remove 80% of a rat liver, and in 2 weeks' time, that will grow back, and without any discernible defects in the liver function test of the rat. And we can do it again, and we can do it again. And so my point is, this organ is such a beautiful organ, and we are almost it's a crime not to use its abilities and its prowess in order to keep people fit and healthy without resorting to such invasive procedures such as liver transplantation.
Right. Thank you, Doctor. Those of you who have questions to ask Dr. Cherian, please put them in the Q&A tab. As always, my request to you is mention your age and your gender so that will perhaps help Dr. Cherian to give you a more considered reply. So please put your questions in the Q&A tab. Doctor, we have got a few questions which have come to me by email, because when we announced the session, there are some people who send in the questions. So the first question is, Can you ask doctor that I was advised that I had a fatty liver when I had done a test when I was 25. I'm now 60, and I don't know whether I should really be worried about that diagnosis so many years back. That's the question. So should this person who was diagnosed with a fatty liver in a general sono, he says, should be worried about a fatty liver at all?
Well, if it was so many years ago and it hasn't changed, well, I guess you could say that it is not an immediate concern. The truth is, fatty liver is very common, but it is not something that we take too lightly, because approximately 30% of the transplants that we do now is due to fatty liver. So it is not a completely benign disease that has got no what do you call that, complications or side effects. On the other hand, vast majority of people with fatty liver disease don't progress to end-stage liver disease. And that's why what I said earlier as to if it hasn't changed for 25 years, then I think we don't need to worry too much about it. So the key would be to look at the progress of liver disease. So if it is, for example, grade 1 fatty liver disease 5 years ago, and then 3 years ago it became grade 2, that is somebody who's likely to progress to end-stage liver disease, and that is somebody who needs to change his lifestyle if we are going to avoid that trajectory. So in answer to the question, if that trajectory is very stationary and there is no deterioration over such long periods, it's very unlikely that in the next 10 to 20 years, this trend will change. But if you've known to have fatty liver disease, it's not a bad idea to get checked at least once a year with a simple ultrasound to see whether there has been any progress or not.
So, doctor, what is the checkup that you would advise people to do for to check
just simple liver ultrasounds or abdominal ultrasounds, and second, a liver function test, which is a simple basic blood test.
So a liver function test and an ultrasound sonography
is all that is needed as an initial screening tool.
Right. Thank you. We have a doctor. We have a question from someone, the doctor, who says, my wife was diagnosed with liver cirrhosis 2 years back and was undergoing treatment. Intermittently, there were 4 to 5 episodes of blood vomiting. And every time she was admitted in the hospital, an endoscopy was done and banding was done too. This time the bleeding was more, but the endoscopy did not throw light on the active bleeding. Emergency procedure for TIPS was performed and stent was fixed. What is your advice for the cure?
So can I have a little bit of a detail on this patient? How old is this patient? And is this patient known to have any other medical illnesses?
Not really mentioned. Mr. Kumar, if you are online, perhaps you could tell us on the chat, and we will ask, I'll throw the question to Dr. Cherian, but I don't think Mr. Kumar is online right now.
So let's try and help his question anyway. So the bottom line is, this is a patient who, without a shadow of doubt, needs a liver replacement, because the liver has reached a stage of what we were talking about earlier of end stage. It's not able to maintain life anymore. But it is not as simple as that. There may be an investigation or assessment that is required to do 2 things. One is to see what caused this liver failure. Has it reached a stage of irreversibility? Given the symptoms that she has experienced, I think she might have, number one. Number two, if she is, for example, 80 years old and has got a cardiac condition as well, a liver transplant is simply not an option and not advisable. because it is just too high a risk to suggest. Whereas if she is 60 years old, has got no other medical illness other than maybe a little bit of diabetes, then definitely it is an option to have a transplant done. And that is the key or the cure to this, rather than temporary measures such as tips, which itself is quite expensive and doesn't give the full benefit.
Right. Doctor, there's another question from somebody about cirrhosis. 69-year-old lady patient recently diagnosed with liver cirrhosis. Doctor has suggested steroids. Is it advisable? And of course, he's asked as to what is the way to do a teleconsult with you. But first is 69-year-old lady patient recently diagnosed with liver cirrhosis. Is it suggested to take steroids?
Well, this is a very specific question. A doctor would not advise steroids without a good reason. So often it is likely that there is a diagnosis of something like autoimmune hepatitis, which is showing a little bit of inflammatory markers being elevated in the liver. And that's possibly why they have been asked to take steroids. So if that is true, then that is quite appropriate. As far as the age is concerned, 69 is among something at the cusp or the watershed level. Around 70, up to 70 is when we do transplants. But to do transplants at the age of 70, we would like the patient to be particularly fit and have no other medical illnesses that are significant. Like we don't want to transplant somebody who has got uncontrolled diabetes and 70 years old. But if somebody who's fit, who's walking around, but 70 years old, has end-stage liver disease, then if we do a transplant, the one organ that is malfunctioning is replaced, and really they regenerate themselves and their quality of life improves tremendously.
Right. Thank you. So there's this question from Atul Suraya, who says, at 61 years of age, being diabetic and high blood pressure and not liver-related history, should I worry about liver-related disorders?
Yes, 61, diabetes, just these two facts suggest to me that a simple screening group of tests is possibly advisable. Like I said before, just a simple ultrasound and a set of basic blood tests, including a liver function test, will give you an answer to that. If the ultrasound suggests a normal liver and normal liver function test, then it's very unlikely that you have a serious liver pathology. So I had mentioned earlier that that obesity and diabetes are the two risk factors for fatty liver disease, and hence my advice on getting the screening tests done.
Right. Thank you. We have a question from Mr. Bharat Bhadeka, who says, I'm 68. I have B12 2000 since long. My gallbladder has been removed. My appetite is very low. I'm a patient of blood pressure and diabetes. He needs some advice on what to do.
I mean, the appetite being low is a very non-specific symptom. It's something as simple as not enough exercise, to more serious things like anxiety, to even more serious things that is something intrinsically wrong with an internal organ, can all present with loss of appetite. So this is somebody who will need to visit a local doctor and try to see whether there's anything particularly relevant in the examination and the history, and then go for a set of bloods and a basic health checkup, which might point the direction as to what is the cause of this loss of appetite, especially if there is significant weight loss. If there's more than, let us say, 4 to 5%. So if you're 70 kilos, if you lost more than 3 to 4 kilos, and there is no good explanation for it, then again, these are things that I would think need a review or at least a preliminary, what do you call that, investigation.
Doctor, sorry to ask you this, but could you raise your volume a little bit?
Yeah,
I think
sure.
somebody has said. So, Doctor, we have a question from Rajesh Sharma.
Okay.
Who says, I'm 52. Well, it's a question which I normally ask only of people who are above 60, but it's an interesting question. It's different. I am 52 and suffering from heavy burping, and it sounds too loud and bad odor as well. There's constipation and bad odor while passing stools. I've been diagnosed for fatty liver grade 1 5 years back. His question is, well, he's not put a question, but I guess he wants advice on what to be done.
Well, these are what I would call GI symptoms, so gastrointestinal symptoms, and unlikely to be due to the fatty liver. So there is several possibilities. It's as simple as there may be some foods. So for example, if you have irritable bowel syndrome, there are certain foods that make you develop more gas than other dietary substances. And therefore, it's a question of keeping a food chart to see if there's anything particular that helps in decreasing or increasing. And something that's increasing it, obviously avoiding that will improve symptoms. An upper GI endoscopy might show something that is of relevance. Sometimes bacterial overgrowth could cause similar symptoms, and something that you can get over the counter, like a probiotic, like VSL3, can bring back normal gut flora. So in other words, bring back the normal healthy bacteria inside the GI tract so that that doesn't happen. So this is something that a gastroenterologist will be able to help you with. And sometimes suppressing acid is with medication, with tablets, can effectively control these symptoms also.
Doctor, you mentioned about probiotics, and there's a question which has just come in. Just a general question asking you, is having too much of probiotics harmful? And things like probiotic medicines or having things like Yakult, etc. Is it harmful in the long run?
So all of these things have got a little bit of fat and a little bit of sugar to make it palatable. So I guess the first point is you don't need it that often. In fact, if you are eating a normal balanced diet, you don't need it at all. God did not design us to have Yakult regularly. So that's the first point. The second point is, I guess almost anything in the world you can overdose. And probiotics, maybe if you're taking it 2-3 times a day, that may be a bit too much. But if you're taking it once or twice a week, or maybe 3 times a week, I don't think it does any harm.
Doctor, this is a question which I guess as a liver specialist, you must be asked this question several times over. But how much of alcohol is safe for the liver?
Yes.
And for senior citizens.
You're absolutely right. This is a question that I'm asked quite a lot. And sometimes I feel my friends have only one use for me, that is to ask me this question. So the answer to this question is moderation, as always, is the key. So how much is too much is difficult to answer because it depends on the size, often the height of the person, because the bigger the liver, the bigger the ability for the liver to handle toxic substances. So if you are a very short person, then rough rule of thumb may be that you can't drink as much as somebody who is 1 foot taller than you. But that's a very soft, I'm sort of half serious when I say that. Almost everyone should be able to consume what I would call social amounts of alcohol, which would be a glass of wine once or twice a week. But if you're needing to drink 2 glasses of wine every day and otherwise you are not able to sleep, then you're heading towards an addiction sort of a thing, which obviously you must shy away from. So I guess if you want to be safe, 2 to 3 glasses of wine or the amount of alcohol in one glass of wine, which is a normal glass, compared to a pint of beer, is almost the same, because the percentages of alcohol are different. And therefore, again, 2 to 3 times a week should not be a problem. Another rule of thumb is binge drinking, where you don't drink anything for a month, but then you bring it all together and you drink a whole lot in one go. Again, that's a lot of toxins in such a short time that the liver has not had time to detoxify it, and therefore these toxins are able to cause a bigger issue. And so that's something to avoid as well.
Right. Thank you. We have a question from Katie Dadanchi, who says, Doctor, I'm 70 years old and I'm on rosuvastatin 5 mg since 25 years. Will taking statins for life damage my liver in the long run? So far, the liver functions are okay. That's her question. And
in general, statins are not commonly known to affect the liver. They can cause issues with muscle. They can cause issues with the kidney, but not that much with the liver. But medicine is such a field that there are certain compounds that agree with. Most people can disagree with certain individuals. So what we call idiosyncratic reactions, those can happen with anybody, but that is relatively rare. So that's the first point. Second point is things have changed in terms of how we deal with cholesterol. We do not believe it is as harmful as we thought it was, and therefore the what I would call the criteria for treating high cholesterol or triglycerides has changed, especially if you're in the older age group and there's no cardiovascular risk otherwise. Then we may be able to tolerate a slightly higher cholesterol than without using statins. So you might want to just check out your lipid profile and talk to your nearest either coronary cardiologist or maybe a diabetologist, and they can review it and see whether statins is still required or not. Along with liver function test, do check your renal function test as well. And if your creatinine is going up, that may be an indication that there may be a side effect due to this, and that might have to be checked.
Right. And Doctor, she also asks that my 45-year-old son has a fatty liver, and would eating only vegetarian food and walking reduce the fatty liver?
I think there is a misconception that vegetarian diet is a healthy diet. It doesn't always hold true. So you could have a nice, rich butter masala that is as vegetarian as you could get, and have what do you call that? A baked piece of chicken that is far more healthy than that. So it doesn't always hold true. If you're cooking vegetables with a whole lot of oil, that is more harmful than maybe fish that is baked or cooked with less oil. So it is not about what is the substance, it's more about how we cook it. Vegetables, fresh, and fruits have many important ingredients that are lost when you cook it. Therefore, a healthy supplement of uncooked salads like carrots and cucumbers and lettuces can have an important role in a balanced diet, along with fruits. Some fruits are high in cholesterol and sugar, and therefore don't automatically assume that fruits are healthy. Beyond a certain quantity, it can be harmful also. So I think it is not about vegetarian and non-vegetarian, it's about how we, so essentially overdosing on sugars, on oil and things like that is the bottom line. That's the problem. And too much of refined foods, again, it cuts out on the fiber that is a part of a normal diet, and that again should be avoided. So if you stick to these rules, it doesn't really matter whether you're vegetarian on non-vegetarian. In fact, because you have a greater choice as a non-vegetarian, I think it is easier to have a balanced diet as a non-vegetarian than a vegetarian.
Spoken like a true Dr. Cherian from Hyderabad. But no, honestly, the thing is that, so a question to you is that, does this differ from geography to geography? For instance, in a city like Hyderabad, you do have a lot of non-veg consumers, right? And the people who have non-vegetarian food versus, say, a city like Mumbai, where perhaps it's lesser. So does the problem also differ from geography to geography? Because you've worked across various geographies, including in the UK. What is your view about that? Should there be a greater concern in some parts of the country as against the others?
I mean, there are perfectly good ways to maintain a balanced diet even as a vegetarian. And therefore, in Mumbai, there are a lot of people who would have a perfectly healthy diet. And in Hyderabad, there will be plenty who have a perfectly unhealthy diet. And therefore, I think it's just a question of educating ourselves and doesn't so much matter about the geography. What I find interesting is, after working so much and so long in the UK, I find that their ability to tolerate a poor diet is greater than ours. So we need to have, we are genetically predisposed to developing metabolic syndrome, part of which is diabetes, part of which is obesity and fatty liver disease. And therefore, we need to be less careless compared to our Caucasian counterparts in order to get the same disease, unfortunately.
That's an interesting observation. Doctor, we have a question from Mr. Manvinder Pal Singh, who says his wife, age 57, was diagnosed with fatty liver in 2016 and put on Unilever 300, recovered. The reason diagnosed was wrong medicine.
Sorry, I didn't get the last bit. Recent what?
Okay, so he says my wife, 57, was diagnosed with a fatty liver in 2016, put on Unilever 300, recovered. The reason diagnosed was wrong medicine. Now again, last month, she was put on steroid for asthma and now again has fatty liver with ALP AS600. From MRI, PSC has been diagnosed. Your views, and is there on any other disease, please?
How old did you say she was?
I'm not very sure. She says 57, perhaps 57 now, or if it was 2016, she was 57, then she would be 60, 63, but roughly around 60.
Okay, so I suspect this is a serious issue, and she does need to regularly stay in touch with a liver specialist. That's the first point. This is not the sort of thing that we can manage on an online consultation. This needs careful review. That's point number one. Point number two is that her AST, ALT being so high is probably to do with the PSC rather than the fatty liver disease. I mean, it's possible to have both. PSC is a disease that is usually diagnosed at a younger age group. So I'm not so sure how at the age of 60, she's been diagnosed with this, but it is possible that she developed it in a mild form earlier on, and it has taken so long to manifest symptoms. And so it is still possible. So the final point is about whether there is a need for steroids. I think it is worth a try because it has an immune component to it. But it all depends on whether the liver is burnt out, whether there are strictures, whether there is a high bilirubin, whether there is sepsis on board, whether we try a trial of steroids, which is why I was saying to you, this is a complex problem that needs a very careful review of every facet of her before a correct advice can be given.
Right, thank you. We have a question from Geeta Malhotra. She says, I have developed an 11-centimeter cyst near the liver, got it punctured. Now, do I need to remove it by surgery? is it going to get cancerous?
It depends. If it is a simple cyst, then it is unlikely to create issues in the future, such as cancers. But there are complex cysts which can turn cancerous. So I guess the right thing to do would be to get a good quality CT scan and to establish whether it is a simple cyst or something more complex than that before you actually touch it. So it looks like she has already had some fluid taken out of it. Maybe it was taken out and tested, and I'm sure they have done these things before. So if all of that suggests a simple cyst, then there isn't anything to worry about, and it's unlikely to cause her any long-term damage.
Doctor, I had indicated to you that we'll end it around 5:40, but there are just so many questions. I'm going to take another 5 minutes of yours. So there's a question from Manoj Kumar Rastogi. He says, Doctor, after COVID, I suffered from liver cirrhosis. The doctor advised a liver transplant, and now he's under the treatment. I'm not going to name the hospital and the doctor, but who advised the following medication. He says Hep Best 25 mg, Cap Henzovit, syrup Lecti-Hep, sachet Canzomin 10 mg, tablet Amiflu 40 mg, Nutrix, Laltra. I know it's an unfair question to ask in a webinar like this, but since he's asked, he's 60, vegetarian and not taking salt or oily food, he wants to know whether this medication, should he continue the entire life. I think, doctor, before you give a broad overview, Mr. Rastogi, the best thing to do is at the end of this program, I will give you the connects for Dr. Cherian. For a fairly detailed question like that, I think it's best that you have a direct connect with Dr. Cherian so that he can give you a proper advice. In a forum like this, these are more general questions, because you are asking some specific things about medicines. I would hesitate to have this responded. But your general comments on this thing, Dr. Cherian?
I couldn't agree more with what you're saying. It is not fair on you or me, or indeed on that patient, because we could end up giving him the wrong advice because we don't know the whole story. And we are talking about small changes in dosages that can cause a problem, etc. Far more importantly, I think, is to know what is the stage of cirrhosis. Is that stage appropriate to the medications that he is receiving? And so I guess what you said is absolutely correct for his own sake.
Yeah. And doctor, there are two more questions that are there. One is from Rakesh Singh. He's 50, but I think the question is important to ask. Normally we put in questions only by senior citizens. He says he's 50. He got a liver function test recently after very high fever, and his report is AST, the SGOT 176, ALT SGOT 168, GGTP 102. His question is, what do these values mean? And perhaps this would be of interest to other people as well.
So we could answer this in a general fashion, not directly regarding him. So in general, these are what we call as liver enzymes. So these liver enzymes are things that go up when there is an inflammation within the liver. So this liver inflammation can be due to viruses, it can be due to alcohol, it can be due to fatty liver, so on and so forth. So I guess this is non-specific, but it tells us that something is not right. Please look for what is not right. So I think the commonest reason for something like this with a fever would be something like hepatitis A, which is one of those viral hepatitis that predominantly attack the liver. If his symptoms settle down, his fever goes away, I think a week or so after the fever goes away, he should repeat these tests. And if they're still abnormal, that's an indication that he must see a liver specialist and check out what is actually causing this prolonged disturbance to liver function.
One last question, doctor, is what is the general, the question about How do you ensure you don't get hepatitis B and hepatitis C? And a few general questions, general advice for a good, healthy liver that you would offer at the last.
So I think the healthy liver bit we had covered at the
Right.
start, which is essentially ensuring that you have reasonably normal sugar levels. Even if you're diabetic, do make sure that your tablets are appropriate to your sugars. In other words, if your sugars are not controlled, increase those tablets with in consultation with your diabetologist. If necessary, get yourself an insulin rather than allowing very high sugars. Number two, don't allow yourself to become too fat. The more the muscle, the better it is. The less the fat, the better it is. And the weight is dependent on your height. Therefore, look up what is BMI, body mass index, and aim to keep your body mass index between 22 to 24, especially in our genetic group. And a balanced diet, moderation in alcohol, I think is the secret of keeping long-standing healthy liver. Coming to this specific question, I think hepatitis B and C are transmitted by body fluids, not by food or contaminated water. So it's blood, semen, and things like that, saliva and things like that. So avoiding contamination with anybody with any of this, that might be making sure that your barber uses a sterile new razor, to making sure that an injection has never even accidentally been used with an unclean needle. I mean, nowadays, almost nobody in their right minds would use a needle again because they're all disposable. But still, occasionally, sometimes because somebody has not been, there are 20 patients and there's only 5 minutes to do this, somebody's in a hurry, accidents do happen. Whereas you could point out, look, that's a needle that has been used. Keep an eye out and don't hesitate to mention it. So I think these are the simple things to do. One very important point is hepatitis B has got a fantastic, effective vaccine. Almost every one of us who's negative for hepatitis B must get it done. There is 3 shots that is required. One is at time 0, one is at time 1 month, and the last is at 6 months after time 0. And then almost always you're immune for life, and then you don't have to worry about hepatitis B at least. Hepatitis C doesn't have a vaccine, so those precautions that I talked about are important.
Sorry, doctor, just to repeat, a hepatitis B vaccine, at what stage should it be taken?
Hepatitis B vaccines are nowadays given to all children below the age of 7, automatically as part of universal immunization schedule in India. But if you are older than 50, for example, you are unlikely to have been automatically vaccinated as a child because that wasn't around at that time. Therefore, all of us should then get tested for hepatitis B. And if we are hepatitis B negative, we must get ourselves vaccinated, all of us.
Right. Thank you, doctor. Thank you very much for being here in this session.
My pleasure.
There are a few questions. There are a few people who want to be able to contact you for a teleconsult. So, would you be able to give us where they could contact you?
So both are fine. Wockhardt Hospital, if they call the Wockhardt Hospital number, I run a clinic there twice a month. So they will be able to easily slot somebody into that. If it is an online consultation also, they could request it through Wockhardt, or you could call our South Asian number also, which is 8070-670-670. The Wockhardt number
8070-670.
670. But people in Mumbai might prefer to call Wockhardt, which is absolutely fine. Both we work in partnership, both are fine.
Right. So I'll just repeat, the South Asia Liver Institute, the number is 8070-670-670.
Correct.
Right. And we will have the numbers for Wockhardt as part of our takeaways that we will publish on Monday evening. So we will publish the takeaways like we do with every webinar. We'll have the takeaways of the session as well as the edited video. on the website of Seniors Today, that is seniorstoday.in. Once again, thank you very much, Dr. Cherian. Festive greetings to you, and in advance, greetings on Easter. And to all of you, thank you very much.
Subscribe now and press the bell icon. Never miss an update.